This next session is going to be on healthcare, something, of course, that's been important for all of us. Obviously, it's existential because we want to live. But more importantly with COVID, is that being able to fight that battle the last almost 3 years now has been a challenge. And so healthcare has become so prominent. And it's an area of focus on the Salesforce side. We've had a healthcare and life science team that's been focused on healthcare from the member side, from the provider side, from the payer side. And again, this is the time of year when people are re-upping for their insurance, whether you're on Medicare or whether you're on private insurance. And so I think that it's important to be able to talk about this a little bit. So with that said, we're going to talk about that from various perspectives. We're going to talk about this from the payer's perspective with HMSA, and I'm sure most of you that are here from Hawaii are very familiar with HMSA. They're a Salesforce customer. We're going to bring them on board. Secondly, we're going to talk a little bit about the public health side and how we were able to measure some of the outcomes and what was being done relative to COVID through analytics. And so we're going to have one of our Tableau team members talk about what we're doing at the Department of Health here in Hawaii. And then finally, we're going to have another one of our team members talk about what we're doing broadly in healthcare and how we're looking to try and improve that experience, from the member side, but also how providers can do a better job and be able to integrate into systems that currently exist right now and make that experience much better. So what I want to do is welcome to the stage Wendy Nakasone from HMSA, Kevin McKinney from Tableau, and then Greg Winters from our very own HLS. If you want to please go up to the stage. And we're going to kick things off with Wendy first. So Greg and Kevin, if you'd like to go ahead, take a seat. And Wendy, we can work with a handheld or work with that one.
I can work with this one.
Okay.
All right. So I'm here today representing the payers. And for those of you from Hawaii, you know who we are, HMSA. For the Salesforce team who came from the mainland, we are the largest health insurer, also known as payers, in Hawaii. We do serve the commercial, Medicare, and Medicaid customers, so all flavors. First of all, thank you for having me here today to share our story. I know we're not a public sector customer, but we're adjacent, so we're close. So let's go bring up the first slide. Thanks. Okay, so really, why did we, so what I want to do first is just talk about our Salesforce story. What brought us to Salesforce? Why did we decide to become a customer? And really, I think the first presentation that Paul did with all the chiclets on that slide was really an accurate representation of what is happening kind of in our industry as well as probably for most of you. So many different point solutions. We would pick the best ones, and oftentimes they didn't talk to each other. But each one of those, you need to maintain them, and you need to upgrade them, and so forth and so on. And so over time, that really becomes very expensive. It creates very fragmented experiences. Things are very siloed. If you want to share data, then you have to also spend time, effort, money to make sure those things are connected. And it really has become sort of an unsustainable solution for us. So we really wanted to look at having an integrated engagement platform where we could really have one overarching platform, and we selected Salesforce to be that platform in order for us to kind of really house our Member 360, have a centralized platform where we could have all the information about our members and customers and have all of our employees go to one place. And really overall, why did we want to do that? It was really to improve the stakeholder experiences for both our internal, our employees who are working with in our sales and servicing areas, but also to ultimately improve our external stakeholder experiences. Next slide. Okay, so we've been on our Salesforce journey for about 4 years. And I remember in the very beginning in 2018, the team, when Salesforce came and did their sales pitch, and we said, well, how long is it going to take to implement something? And they said 6 months. And we laughed because nothing has ever taken only 6 months. But I will be honest with you, the very first release we did was within 6 months. And it's echoing everything else we've heard this morning. It's an iterative process. We do the user stories, we use Agile, and then we kind of just chip away and bring other people on board. We started with a smaller function first, and then we brought in more people and more people. And so it really is hard to believe that we're just finishing 4 years. We have our entire sales organization, all the different types of lines of business, all on Salesforce. We have all of our servicing on Salesforce. So that's a pretty large portion of our company. I think 85% of any phone calls that come in are serviced by people who have access to Salesforce. So it's all on one system. We also did take advantage of Velocity, which has then been acquired by Salesforce and is part of Salesforce Industries. So it was a healthcare specific, a payer specific managed care package that we use on top of Salesforce that really brought in a lot of the workflows and information that's already specifically made for the health insurance industry. So that really helped move us along as well. We have a little bit of Experience Cloud, which used to be called Community Cloud. We use that as sort of the backbone for our employee community, which was really important for us during COVID. It was a way to get information out. It was essentially our intranet. It is our intranet. And we did a naming contest for that too. So very similar themes. And then we also have Marketing Cloud, which really is a digital engagement tool. We're using it a little, and we're starting to use it more. So it's a way to do campaigns to whether it's customers, members, providers, partners, etc. And I would say we haven't yet done enough on that, so we're still working through that. In terms of how we did our implementation and how we support our Salesforce efforts on an ongoing basis, we have focused teams on both the business side and the IT side. And I think one of the big success factors is for Salesforce, it's one team. The team works very well together. We have supporters on both the business side and the IT side, and that really is a great partnership. We've had experiences prior to this where we had much more focus on IT or much more focus on business. They don't work as well. So for this one, it's been a much more balanced approach, which I think has been one of the keys to success. We've also, when we first implemented, same thing, we didn't have any Salesforce expertise in-house. So we did use Salesforce services for our first couple of implementations, but we have now transitioned to having a very important partner, Pacific Point, who is here today, and they've really become an extension of our team. You know, it is hard to hire Salesforce resources and to keep them. You guys all know this, right? And so if not for the support of Pacific Point, it would be really difficult for us. So they have been really an amazing partner and a great extension of our team. So thank you, Dina. All right, next slide. Okay, so what have the outcomes been? Because we really are a few years down the line now, and happy to say that we really have a much better experience for our sales and our servicing teams. So we've been able to reduce the training time because you don't have to train the teams on many different applications. They're just learning Salesforce. There's integrated workflows between the departments. I know our servicing team, before we got onto Salesforce, had to pull up 17 different screens when they logged in the morning, because we had so many different applications. And in order for them to do their jobs, they had to have all the applications open and ready to go. And we're not down to just one yet. We're getting there, but I would say we're now down to about 4 or 5 different screens. We're still working on integrating more data into our platform. But that's been a real change for them, just in terms of just open that one system and pretty much everything's there. And then also we have the knowledge that everybody uses in our company, right? So if there's any information in there that is used by our servicing teams, anyone else in the company can access that. So that's been a real help as well. From a leadership perspective, we've really have improved visibility and insights to performance metrics. Maybe the sales team is not that happy with that, but we can very easily, our leadership can very easily see what's going on. Where are we having problems? Where do we need to, provide more support? So that's really helpful as well as in terms of call volumes. Why are people calling? What can we do better to help serve our members? And then we have been able to sunset some of our legacy systems. We would like to sunset more, so we still have some work there to be done, but that is kind of where we're headed. All right, so road ahead. Really, it's to continue to work towards a more complete Member 360, right? So like I said, going from the maybe 4 or 5 screens, I want to get to 1, right? So we want all that information to be brought into the system. We're not there yet, but that's on our roadmap. Optimizing Marketing Cloud, which is really the digital engagement tool. We've used it kind of in a very simple way, but we want to do more sophisticated journeys. So for example, you send out an email, if someone doesn't respond, you send out another. If they respond a certain way, you send out a different one, those types of things. So we're kind of working on that. And then really, as you all know, Salesforce is an investment. It is one that we are very committed to, but we also we know that there are things within Salesforce that we have not turned on yet, that we would like to, right? So how can we really increase the value of the investment that we've already made? And that's kind of our Salesforce journey.
Okay, great. Thank you, Wendy. Appreciate that. And again, Marketing Cloud, as Wendy mentioned, is around digital engagement. But if you think in the public sector, it's like outreach. So the ability to reach out to stakeholders within the community to be able to make them aware of what's going on. So it's a way to then have a much, again, richer experience for those individuals, again, whether it happens to be a member within healthcare or happens to be citizens or residents in a community. So with that said, let me bring up Kevin McKinney with our Tableau team, talk a bit about what we're doing to help support the Department of Health here at the state of Hawaii.
Thanks, Bob. So in the summer of 2020, I engaged with an organization that was kind of in free fall. The Department of Health, the public communications epidemiologist for the Department of Health, reached out to us with some seemingly very basic questions. How do I build a visualization that shows me this? How do I do the math that shows me that? And this is where a lot of analytics questions start. I worked with this individual and his team, enabling them, helping them figure out the math, helping them build the visualizations that they need. But long around the end of October, beginning of November, I got a call. What this individual told me was, I can't do this all by myself. We didn't talk about how to build a chart. We didn't talk about how to do the math. We talked about the fact that he was wearing too many hats. And a lot of you, I see you nodding your head, because you're wearing too many hats too. He was the application administrator. He was the primary content developer. He was learning how to do all of this by himself. He was teaching his team how to do it. He was also the chief public communications officer and the face of the organization when Twitter and Facebook and everybody else was demanding every day what the death toll was. I can't do this all by myself. And what I told him was, I got you. Let me take some of those hats. I'm really glad that the Nevada DMV did the little OCM, because that's such an important part of this conversation. Because so much of the problem with your data modernization strategy is that it happens gradually until it happens all of a sudden. So for this organization in free fall, they needed not just a dashboard. they needed not just analytics, they needed organizational change management. They needed guidance, they needed project management, they needed advice, they needed application administration. They needed to take all of the hats off of the various different SMEs, or in most cases, the one poor individual that gets to wear all of them at once. So a lot of folks take a look at what a technology solution brings them, and they're reminded of that Staples commercial. Just press the easy button, and the technology will do everything for you. But we all know that that's not the truth. That we need more human capital to help implement and execute and be successful with the technological resources that we're bringing to bear. So we did, Tableau, bring to them a technological solution that helps them to automate their workflow processes, to make it so that they went from an ability to talk about public health issues on a monthly or weekly basis to telling you what the daily count was. Because that's what the public needed, because that's the audience that mattered. But we also helped to bring in a team that helped them take all of the different data resources that they had at their disposal, some of which were in high-tech data infrastructure, some of which was paper documents coming from hospitals about their daily counts. We were able to help them overcome what is very commonly the case in public health and in every other public agency, which is turnover, an over-reliance on consultants, and just bringing all of the information that needs to happen in order to guide the process forward to help keep a steady state. So we've been working on, go ahead, next slide. So we've been working on building visualizations with them, but this is just the start. We've built, go ahead again, a number of different dashboards for them, but behind all of this work is the process of helping them learn how the tool works, helping them bring the data resources together, helping them evaluate whether they need on-prem resources or software as a service, helping guide them to successful implementation and successful adoption throughout the organization. And don't get me wrong, this is a process that is always happening. There will be no end to their data modernization journey, because as soon as they figure out the solution to today's problem, tomorrow's problem will show up. So we've worked with them to build out their COVID strategy. We've helped to keep the COVID strategy as modern and up-to-date as the new data resources require and allow for. But we've also helped them, go ahead to the next slide, move into new sectors of what they need to talk about, like MPOX or flu, or other areas where they need to be focusing and pivoting and be flexible and agile. The value of the technology is in the ability of the people to use it and the audience to consume it. So we brought the whole team to bear in support of the Department of Health. We brought our technical experts in our services team, we brought our project managers in our advisory team, and we brought our blueprint advocates in our success team. We've worked with them consistently for 2 years, and eventually we're just going to hand it all off to them. But in the process, we've been teaching them and advising them and working alongside them to help make them successful. The goal at Tableau is to help the people see and understand their data. We don't ever want to be in the situation where we are your data infrastructure. We want to give that power to you. So as we go through an implementation process, as we stand up and strategize and advise and build a success plan, Know that the goal at the end of the day is for you to be successful and to stand up on your own. And that's what we've been doing with the Department of Health. Thank you.
Thank you, Kevin. Appreciate that. Very well said, and continuing to expand our efforts at Department of Health. And so with that said, too, Greg Winters, who is with our HLS team, our Health and Life Sciences group, will talk a bit about kind of our broader approach, too, to healthcare and our technology through Health Cloud. So, Greg?
Thank you, Bob. As Bob mentioned, I manage the account teams that are responsible for large provider organizations throughout the western United States, including locally Queens, Hawaii Pacific, and Castle Medical Center. So the last 3 years have, can you advance the slide? Thank you. So the last 3 years have by far been the most stressful for American healthcare, bar none. So the beginning of the pandemic, hospitals were empty. Then they whipsawed to being overfull, operating rooms empty, ICUs full. They've been dealing with the Great Resignation, and they've been dealing with vastly changed consumer expectations on digital experience. So there was a gigantic spike in the use of virtual visits during the pandemic. It has leveled off at 38 times the level it was pre-pandemic. So people have a very different expectation on how they are interacting with their health system. And the net of all of that is health systems are going into 2023 in their weakest financial situation ever. They are seriously financially stressed. And so if you think about what is the path forward to address consumer expectations on digital experience, to address retention and recruiting of providers, we believe it is the connected experience, connecting constituencies from internal to external, patients, community members, all on an integrated platform. And so you've seen the Salesforce Consumer 360. How this applies in healthcare is the Patient 360. So we put the patient and the provider at the center of the experience. We surround them with transactional systems that maintain that Patient 360, and then we have analytics and interoperability, marketing automation to illuminate and drive forward that patient experience. If you think about the importance of patient experience, there was a recent study that showed that patients feel like if they are treated as an individual, they are 295% more likely to rate that provider organization as providing excellent care and an experience. An example that I really love from one of my customers is they were interviewing their patients, and one of their patients came to them and said, you know, I've been a part of this health system since I was a kid. My pediatrician was part of your medical group. I had 3 babies here. I had breast cancer treatment here. And really, you're my most important commercial relationship. But with the exception of my primary care physician, I feel like you don't know me. I feel like when I call up pets.com, they know me more than the contact center agent at the health system. And so that's really kind of what we're trying to address, is the connectivity between the consumer and patient experience and the health system. And people will say, Greg, well, so what's the ROI on providing better experiences to patients? My answer to that is twofold. First of all, it's the right thing to do. If you are the CEO of Queens or Hawaii Pacific or Castle, your family gets their care at those health systems. Do you want your family treated as an individual or someone that's completely anonymous? Secondly, there are reimbursement models that are accelerating in our industry where providers are paid to keep patients healthy. And the deepest penetration of those at-risk reimbursement models is here in Hawaii. So providers are incented to stay more engaged with patients, to keep them healthy, to keep them out of the hospital, and that's the ROI. So for those of you that know anything about healthcare, you know that health systems have done massive investments in systems that are called electronic health records in recent years, and people say, well, what's the difference between what you're doing, Salesforce, and the $100 million investment that we made in EHRs? And the answer to that is think of EHRs as being kind of a moment in time, a clinical encounter. When I'm sitting in front of a physician or a nurse, they're doing their documentation, their orders. That is the domain of an EHR. But what about all those other interactions between, the 5 years when that patient is healthy before they come back? What about someone who's not a patient yet, who's just moved on island and who's looking for a primary care physician? So Salesforce really provides that longitudinal view that sits on top of the HR. The HR, patient encounters, a moment in time, Salesforce provides that longitudinal view of the patient. So if you think about how you can use this system and how you can engage with patients, one of my favorite examples is Children's Hospital on the West Coast is responsible for providing population management for asthmatic pediatric patients. Right? So they are responsible for something like 50,000 kids in Southern California. And so every night they get a download of the forecast of air quality from the local air quality district, and then they put their kids on journeys based on their age and their channel preference, telling them maybe if air quality is just going to be moderately bad, to avoid strenuous exercise, to something like absolutely bring your inhaler to stay inside. And obviously it depends. If it's a 5-year-old, you're sending an email to the mother. If it's a 16-year-old, it could be a text to their phone. You can put prompts in to make sure that they got the message and acknowledged it. Otherwise, someone from case management is going to follow up. Those are things that you could never do in an EHR. You would never download air quality data into an EHR. You'd never be able to segment a population and put them on individual pathways like that. And that's an example of the big difference between what we're doing and what an EHR can offer. So these are some practical examples of use cases that we support within healthcare and provider organizations. It's built as a platform, but we call it crawl, walk, run, start small in provider relationship management, in contact center, concierge medicine, marketing automation, all of these different areas leading to a full deployment of a platform. And then I'm going to end here on an example from Cherokee Nation. So at the beginning of the pandemic, Cherokee Nation received block grants from the federal government through ARPA. And it was really up to the individual tribal entities on how they would distribute that money. And so within 60 days, they stood up a Service Cloud offering that would essentially manage all of the grants and applications coming through the tribal members. And so far, up to today, 313,000 different applications have been processed through the system. Simultaneously, they implemented Health Cloud, first for contact tracing for COVID, and then their vaccine administration efforts. And today, the system is the primary portal that the Cherokee Nation uses for both healthcare and other types of interactions with their tribal members. And I think this is just a fantastic example of our value proposition within healthcare. It's the ability to connect enterprises with their constituents. It's the ability to be agile and to go fast. And I think that just encapsulates what we're doing in this area. Thank you.
Thank you, Greg.